All right. So, doctor, you already have some questions with you. So
Okay.
should we start answering one by one?
Yeah, we can do that.
We have more people joining in slowly, but I think we can start. Yes. Um, Naida will not be joining us today, Naida, but she has written a question that what are the best kind of exercises we can do, which is, of course, a general question. But what do you suggest? Is it the stretches or the hardcore cardio exercises, or what kind of exercises one can do on a daily basis?
So depending on what the individual is having trouble with, I mean, if someone has, you really want to work out full body because MS can affect, someone's right hand only. It can affect only the right ankle or only right hip flexor. But in general, balance is affected. So you really want to work on the hip stability, core stability, and ankles. So I would focus a lot of workouts on that, training balance. But really, if you can get into the habit of doing a little bit of exercises for everything, training the memory, because we can have cognitive impairments. So if we can combine a little bit of hip, core, and ankle stability with some, memory games, and as well as just keeping yourself active. And I think the really main thing is getting into a habit of what can the individual do that they're going to enjoy, so we can stay consistent with it. So some people on here do yoga, some
Yeah.
people do hikes, some people try to run, some people love the pool. Whatever it is, we just have to find what is going to be exciting for the individual so they can stay consistent with it.
Right. Doctor, speaking of the exercises, there's one more question which I, usually get, but I've not got written this time. But people ask me about some kind of memory exercises or the brain exercises. What exactly is it, and how do they help us?
Yeah, so there's a lot of apps that you could do, Sudoku, just because what happens is if the memory starts to get impaired, little by little, it's going to make it harder to regain that ability to, let's say short-term memory. Or I have a lot of patients that will say that they're, they're doing something and then they forget and they have no idea what they do. So planning gets affected, and then they miss appointments, they miss things. So working on the memory games can just help kind of prevent that a little bit, but also seeing like an occupational therapist or somebody that can give you some organizational tasks. Using a planner can be helpful. Using a Google Calendar can be helpful that way. It can keep everything, in line. So just so we can kind of stay focused and not make sure we're not missing appointments, missing things on a daily basis.
Right. The other question, doctor, that we had received was about overheating. What should a person do about overheating? We have spoken about it at last time as well, but it would be nice if you can just guide them again.
Yeah, so a lot of my patients that come in with exercise, if we're going to be doing some higher intensity stuff, or, really just making sure you're drinking cold water throughout the session, throughout exercise, have a cold towel nearby. If someone's going for like a hike or a long walk, use a cooling vest. But really just make sure that you are keeping your body not in a very warm state. So by trying to use those simple things, that should help out.
All right. Doctor, there's one question which I have. So people, while exercising, have lots of protein shake or things like energy drinks like Gatorade. Do you think that it's normal or good to take it otherwise because they might be having a lot of sugar in them as well?
Um, yeah, so I mean the Gatorades they do have a lot of sugar in them. And we want to try to avoid sugar in the body as much as possible. But definitely, there's so many different types of proteins out there. So just really trying to find something like all natural is the best way. But there's ways to do that with just like healthy eating as well. So I would just try to stay away from like the high sugar drinks and foods, because although they're advertised as healthy, they may not be.
All right. Before proceeding to the other question, is there anybody here who would like to ask to the doctor any question? Elizabeth, Resty, Diane, Claire.
Hi, Elizabeth.
Hi.
How
Hi
are you?
guys. Yeah, fine, doctor. I have a question about my struggle. about exercise of my MS. Okay, I want to ask you how about my exercise in bladder problem, doctor, and how long to I exercise for a day, and the best, what is it? The best exercise from the easiest from the easiest exercise.
Okay. Ritu, can you help with the question?
I actually missed the first part. Like, you have problem with what, Resty?
What? Sorry?
You said that you have problems somewhere, and then you need the easiest exercises that you can do.
Bladder exercise. I mean, bladder
Yes. So
exercise.
have you seen some of the videos? Because we've been making week by week. I think we did 3 or 4 already on specific exercises. So if you can refer to the videos, because each week we give 6 different workouts. It's very hard to kind of give like a general what kind of exercises like through the phone. So we've been making the videos that way you can watch them and follow. Really, the main recommendations is if you haven't exercised in the past, you want to start like 1 round of each of them. You don't want to go from no exercise to an hour your first day. I like everyone to start with like 10 to 15 minutes to begin. Make sure your body can recover nicely from it. And then as you go along, progress, instead of doing 10 times, maybe 12 to 15 times. But really, everyone is so different. So that's why I tried to break up the video so everyone can kind of follow along at their own pace. But you want to try to get a combination of everything. You want to work your ankles, you want to work your knees, your hips. You want to try to throw in some balance exercises. I think last week we said, if you're laying on your back, simple things like bridging or just doing a leg lift. If you're sitting down, pumping your ankles up and down, or just doing things like standing up from the chair. But really, whatever you're doing throughout the day, if things get difficult, those are the things you need to practice. So if like going up a flight of stairs is troublesome for you, then try going up and down a step maybe 10 times with one leg, 10 times with the other leg. We have to try to retrain the body to, rebuild the strength. But we do have the videos. I think there's like 3 or 4 of them now that you can watch, and they show different exercises.
All right.
Have watched your.
All right. Claire, you were asking some question? Sorry.
Yeah, I was really surprised actually. I got phoned by my physical therapist that I'd never spoken to from the NHS. My MS nurse had referred my case to them, way to her and telling her about my journey, steps, about my daily walk. I chatted with Dr Zolo and Dr Gretchen, and I was telling her about the program that I was on with Dr Gretchen, and I told her all of my exercise program and my steps, and I said to her, and she didn't really answer the question, do I need to be adding in any cardio? And because I'm doing a lot of walking and getting cardio that way, she came back the following morning and wrote a lovely email and said she was ever so impressed with how much I was managing, and that she didn't think that I needed to add in any therapy band exercises or anything like that. She classed me as being highly active and highly fit. So I just wondered, Dr. Zolo, is she right?
Yeah, I mean, it depends what your goals are. So
Breaking up a little bit.
if your goals are to maintain walking and you're doing everything, then you're okay. I'm sorry, someone not muted. To figure out, are you having trouble with anything around your house or around what you're doing? If you're exercising, no problem, then we're okay. For I treat patients, we're always trying to progress them, because even if someone's strong, you could always make someone stronger. So it really, everyone is different. It's always better to progress than to just kind of stay doing the same thing you're doing. So if you're doing something 10 times, there's no reason not to try 12 or 15 or 20. you know, if you're so this goes back to how you said before, should I walk less? And I said no. So, you know.
Yeah, it's just that I get rather fatigued if I walk too far. So I'm now walking about an hour 5, an hour 10 maximum. So, but I started out at 20 minutes.
Yeah. Oh,
So
if
I've
you're
come quite a long way.
right, so if you are getting fatigued and you can strengthen some of those muscles that are fatiguing you
Yeah.
by at distance, then you can maybe reduce that fatigue. So, okay.
I have reduced the fatigue over the last week just by going in pace mode rather than sport mode, because I was going off really, really, really fast and getting
Right.
a bit of a. But my partner now said, Claire, you're in sport mode. And he said it to me this morning. He said, can you slow down? Because you're never going to get through your walk. And I was only about 10, 15 minutes in. But that's just
Okay.
me. So,
Claire, I want to try to get to some of the questions. So if we can, you know.
yeah, I'm done. Thank you.
All right.
Elizabeth, do you have any question to ask the doctor?
Actually, okay, I'm actually a patient of Dr. Zolo. I do live in New Jersey, and I've been seeing him a couple of months, but with COVID, I had to stop. So my question is, Dr. Zolo, because I have the positional vertigo, is there any exercises that any type of head movements that I can do, maybe at home, to maybe like.
What do you feel like? Do you feel when you get out of bed, when you look to the right or when you go to the left? How do you feel like, which one do you feel?
I lay flat and I turn my head to the right or to the left, I start to feel that spin. And even if I'm too fast out of bed, I get a little dizzy. And
yeah, so that's a good question because their vertigo is pretty associated with the MS. So I'm not sure if we ever showed you like the neck strengthening exercises, the chin tucks, or the ones with patients, but really just to avoid getting out of bed just straight up, I would try to keep the chin retracted, roll onto your side, and then kind of sit yourself up. That way it gives you a little bit of stability through the neck. But also, I mean, this would be hard for you to try on your own, but there are maneuvers to help get rid of the vertigo, and it's called the Epley, Epley. But that would require you kind of going off the edge of bed with your head tilted over a pillow, and if you feel vertigo, you kind of want to wait for that vertigo to pass, wait 30 seconds, and then flip on the other side. I mean, like I said, it's a little bit challenging to do this on yourself. So in the meantime, you just want to try to avoid like getting out of the bed quickly. So try to chin tuck, lay on your side, and then come up. And then if you notice that to the right is really bad, try going to the left. If it's both sides, then it could just be that it's a little bit of instability from the neck.
Okay.
But yeah, that's a new one. What you could try is like you have the band at home that you were doing your legs and your arms. You could really just have a band behind your head and try to do like retractions, hold for 6 seconds, and do like 20 of those just to try to get a little bit of neck stability. But if it's a true vertigo, then that's something that needs to be corrected by using Epley maneuver. I could text you the specific one.
All right. We have a question from Violet here. She has written, what is the best way to control temperature? It's a new symptom and I got. I couldn't control heat, but now it's cold.
Okay. It says
Violet.
So yeah, I mean that could be just depending on where Violet is living. I mean, if it's a really hot area, that's something that we talked about in the very beginning, is just trying to keep yourself cool. Like if it's warm, then I know a lot of individuals wear a cooling vest. That's been pretty helpful for them, or just carrying around a nice cold bottle of water. You can use cooling inserts for the shoes. That can help. So she lives in California, so it's definitely pretty hot there. But you know, I would really just try like carrying around a cold bottle of water, using a cooling vest, or you can use shoe inserts that kind of keep your feet cold, because if the feet are cold, that'll send up, you know, a little bit of temperature regulation up the chain. So if you're feeling extremely cold, honestly, at that point, I mean, it could be, that's something I would discuss with the neurologist that you're seeing, because it might be like some, you know, a mix of the medications. It's possible. But if it's a very hard kind of question to answer. I know acupuncture has been shown to help with temperature regulation as well, but if it's something that's fluctuating from like sensitivity to heat and cold, I would definitely talk to the neurologist around there.
Right. Lots of people do complain of cold feet and hot feet. So I think that is something which comes to everyone here. With it, it is related to MS, and you need to contact the neurologist. Um, any
We
other
also have
questions?
to make sure, like last week we talked about the numbness in the feet too. So that could also be from the low back. So we have to
Right.
make sure that we are clearing the low back. And, if she can, the video we posted, which was making sure you're not bending or twisting, like when you're doing simple things like laundry or just picking up dogs around the house. But we have to make sure we're protecting the spine, because that, can also cause a lot of nerve tension.
Do we have any more questions from you, Vision and Hada?
Yes, please. So, doctor, basically, before getting MS, I was playing volleyball. After that, by the way, that time I was about 15 years old. After that, I felt good. I mean, now I'm doing well. I'm great, but kinda I'm afraid of going back to stadium and playing volleyball. I even, I'm even afraid of going to a gym and doing sport as a normal person. How do you think? I mean, my question is, can I be as a normal person and just playing sports, doing sports?
Yeah. So what is your age right now? You said this happened when you were 15.
Yeah, and now I'm 20.
Okay. Yeah.
Mhm.
So, someone asked me before, like, how do you really prevent disability with MS? And really the key is to exercise as much as possible, because, just because of this a lot of times individuals will get a diagnosis and they feel like they have to stop everything, but that's not necessarily the case. I mean, the key really is to maintain strength as much as possible, as long as possible, by keeping yourself active and exercise, because, like volleyball is very active and you're keeping a very good cardiovascular system when you're running back and forth. You're working on reaction time, you're working on coordination. If you go from doing all those activities to nothing at all, then it's going to become very hard to do simple things like walking. So I definitely, I don't know how your balance is or anything like that, but you definitely
Great,
want to
great.
perform. Say that again?
Yeah, I said I'm good. I'm great. I mean, my balance
Yeah,
is
so
great.
if everything is good right now, then really, I mean, the goal is to, you get this diagnosis, but you want to live your life as normally as you can, and not let it tell you that you're going to stop doing everything, because, I'm not sure if it was just more of like the confidence thing, but don't, look at it as something that you're going to push through and not really stop everything, because right now you're very young. So if you limit your activities now, then it's going to make life growing up even harder. So while you're young and feel good, this is the time to really try to keep yourself active and exercise.
I
Thank you.
think you can also refer to the post-MS exapparation exercises that you had shared, Doctor. I think that's the right way to start.
Yeah.
So we have a video shared by the doctor on our IGTV and doctor's link also, and you can see the exercises and such doing those. Okay. Moving to the other question that we have. Um, um, Doctor, we also have a question saying that some people, when they wake up in the morning, they have backache and they have stiff backs. Is it kind of their sleeping position or the kind of mattress they are using that something of such?
Yeah, so 100%, it could be the mattress. I mean, you don't want to have the same mattress for more than like 8 to 10 years, especially if it's like a spring mattress. Those will wear down. Stiffness in the back, if it gets better as you walk around, that could be just general arthritis, in which case you want to just try doing some stretches in the morning. So like if you're in the bed, you can try just bringing a knee to your chest, holding for about 5 seconds, doing some side to side motions. But a lot of individuals will get stiffness in the morning, and as they walk around, it can improve. So it's really either a matter of just like the mattress needs to be replaced, or it's just a little bit of arthritis in the back that gets better with movement. And in regards to sleeping position, you want to really just avoid sleeping on your stomach, because that is the worst position for you.
Right. While speaking to you, I just got a message from Samantha. She has written that since of late, my right knee, the stronger knee in her case, has been twisting a bit while walking, not buckling, but it's kind of weird, never happened before. Can you suggest something that why is this happening to my knee?
So the knee twisting, it could be a weakness from the hip, because if the hip flexors are weak, then the knee can kind of compensate and not really allow the hip to come up. It could be from the weakness in the ankle. The ankle from below is not stabilizing. It could be a weakness from the quad or the hamstring. So there's really a bunch of different ways. Are you feeling knee pain, or do you feel like it's just twisting out?
She's saying that it's twisting. And she said that that
Yeah.
stronger knee as well. The right side was stronger for her.
Yeah, very difficult to answer that without seeing the individual. But I would recommend seeing like a physical therapist where they're at and giving them that issue, and that way they can really do like a gait analysis.
Right. I'll let Samantha know about this. Moving on to the other question that we have from Jascola. She has written what to do for numbness that starts from the stomach and goes down to the feet.
Um, yeah, is again like without, if you guys can try to maybe give like specifics, because when I'm not meeting you and I can't evaluate, it's very, the first couple of sessions we had quite individuals ask like, what can I do for foot drop, what can I do for core strength, what can I do for fatigue. I can't really answer those specific questions without seeing you guys. So if we can maybe, yeah, I can't really answer that. Numbness can be coming from the spine, um, but really just try to get evaluated by a physical therapist out there. Note these things to your neurologist. They can kind of help guide you. We had some questions about nutrition before that we answered. So individual kind of problems, very hard for me if I'm not, meeting you guys.
Right.
Neck pain, that was a good one. We had some questions about what can I do for seated posture. That was able to kind of go over.
Violet has written one more question. She has written, I started experiencing some weird pain on the top of my feet when I walk. Not all the
Okay.
time, but I get it especially during my morning walks. I've checked bruises, cuts, but nothing. Feet are not swollen either.
Yeah, so it could be that the sneakers might be too tight. It could be that if there's numbness in there, and you might be, so really just check to make sure you're not dragging your feet, because sometimes we develop like a little bit of foot drop. So we have to also make sure the sneakers are not too old. If the feet are flat, you can do some arch exercises, but we got to take a look at what is going on. Maybe there's something occurring that we're not, and it says it's more in the morning walks. So it could just be in the morning that the feet are a little bit stiffer. So if we could try to do some like calf stretching, ankle pumps, just bringing the feet up and down, doing some like ankle circles, getting them warmed up, because it was similar to the back pain. If we have pain when we wake up in the morning and it goes away, it could just be a little bit of stiffness or arthritis. So the key is getting those muscles warmed up before activity, and we can help prevent some of those symptoms.
Right. But we have another question, which laces.
You're welcome, Violet.
Mr. Moore has written, my fingers in the hand are always tingling. I keep flexing my fingers, but no relief.
What part of the fingers? Is it the right hand, left hand? What part of the, so if the part of these two fingers, this is more like the median nerve. If it's more the pinky side, that could be more so from the ulnar nerve tension. So if like everyone is seeing if their arm, it can be straight, they could extend their arm, extend their wrist. If that makes the hands tingle a little bit more, then that means that's the nerve that's inflamed. So you'd want to try to repeat that about 10 times or so. That's if these part of the fingers are numb. If it's more the pinky side, then we could have our hands this way and kind of go up like this. If those start to get a little bit tingling, that means that nerve is inflamed. I would really recommend, if that whoever's experiencing those numbness or tingling, to get like an EMG or a nerve test. it can pinpoint exactly where that inflammation is coming from, because the tingling could be coming from the neck, it could be coming from the elbow, it could be a carpal tunnel. So once you get the nerve test, it can differentiate where exactly the tingling is stemming from. And based off of that, we can kind of give some specific exercises.
Right. Doctor, it's about me. I've been getting a lot of numbness. It started when I got MS, but it's right here. And when I don't sleep, I'm late sleeping and I'm too fatigued. This is the only thing which actually flares up. And of lately, I'm getting a lot nowadays. Do you recommend
Does
some?
it get worse? And it's like doing this at all? Bring your wrists up and down. Do you notice that anything makes it worse?
No, it doesn't. It's just there. It's just there. It doesn't happen more or less. It's just there permanently.
Yeah. You could try doing the one where your arm extends and your wrist extends.
Yeah.
And if that doesn't increase it, look away. So look over your left shoulder.
Okay.
Yep. And try doing about 10 of those and see if that helps reduce some of that tingling through the fingertips.
Okay. Thank you, doctor.
Yeah, if we can do something with our body that increases the tingling, that means it's more like an orthopedic musculoskeletal thing, and then we can give specific workouts for it. If it's just like, because especially that it's on one side,
Yeah.
it's probably some like nerve tension. If you're reading a lot with that hand, it could be coming from the forearm. So doing some like forearm stretches, you can kind of have your hand this way, lean, like if you were to have your hand and kind of like lean on something and lean forward, you'll feel a nice stretch through the forearm. That can help relax some of the tension through the fingertips.
Okay, but in my case, this has been there. So when I got MS first, this was my first symptom. And there was numbness in all my fingers slowly, but it started with this. So whenever I'm fatigued or not able to sleep well, this is the first thing which I usually get.
Have you ever had the nerve test?
Yeah, initially I had when I had got MS, but that was all
Right. Did they?
time. After that, I had never gone through any kind of test.
Yeah. Try that one day we spoke about a lot of the postural exercises, stretching out the chest, stretching out the middle back, or even the ones we showed that we're going to show with the MS hug video. Since you have the sneak preview, try those and see if that releases any of the tension. You try those 3 or 4 specific exercises and see if you find one that you might get a little bit more tingling in the finger, that's the one to focus on.
Okay, thank you.
You're welcome.
Okay. Doctor, there's another question by Susie Lagos, and she has written, is there any kind of exercise that you can recommend for hand tremor? Is this the same exercises that you're talking about?
No, so for hand tremor, so that's a good question. We haven't had that one before. A lot of times tremor is at rest, but as we kind of go into motion, the tremor stops. So with a tremor, we use this a lot with our Parkinson's patients. We want to do more weight-bearing exercises. So if we had our hand, we were to kind of place it like on a wall, we could do wall push-ups, or you can take a towel, try doing some circles, because now the hand tremoring is on the wall and it should stop shaking. And if we could try to provide that stability, it can definitely help reduce it. Also, if someone has like a kettlebell, we can try to hold a kettlebell this way and walk with it. That can help reduce any type of stability. So I would try with like wall push-ups and then having your hand doing some circles, things of that sort.
So big exercises. Okay. Do we have any other question coming from you guys?
I have a more question.
Yes.
What is the differences between working with a normal walking and working with the heels? What is the differences and what the benefit of working with heels? With heels, what was it?
Heels.
Can you type your question? Can you type it?
Okay.
Do you mean walking with heels or walking on your heels?
Walking.
I'm gonna look in the chat right now. So
Walking.
yeah, walking with heels. What do you mean by like what is the difference? So I mean walking. I know walking with heels, not personally, but from what the patients tell
Because
me,
I
is
was uh,
a lot harder than
I
it's
was
definitely gonna throw off your more. Is that what you mean? Like what is the difference between walking with heels and not and like with sneakers?
Are you talking about the
yes.
heels?
I mean, what is the benefit of walking with heels? Because I was so in one of your videos in a foot drop exercise. One of the exercise we must
I got
walking
you.
with the
I
heel.
understand. Yeah, so
Uh,
trying to walk on your heels is going to build the strength in the front of the shin. And a lot of
uh,
times the foot drop is one of the biggest symptoms that individuals with MS might get. And that's how we get trips and falls. So practicing heel walking without kind of rocking your body backwards and forward. Let me see. How do I flip this? So doing like
oh,
this, keeping your toes pointing up, that's going to build the strength throughout these muscles. If you balance better and to avoid falls, because many times falls will happen if someone's trying to bring their foot up and it gets caught like on a curb and people will fall forwards. So walking on the heels will kind of maintain that strength. It'll also throw off your balance as well. That's the benefit to prevent that foot drop.
um, but for now, I can do I can do I cannot do stand a strong stand with heels.
Yeah, so
I
try
cannot
doing it
strong
seated.
stand with
Right. So try
oh,
in a seated position first. Like try doing a lot of stuff seated, and then from there try to stand up, but holding on to like a wall or something. That way you have some support, and then at that point, once you're stronger, you can try doing like gentle walking while holding on to something, and then once that gets a little bit better, then you can do it without it. But you know, if even if it's something you can't do while you're walking, at least practice in a seated and standing position to build that strength.
okay. Okay. Thank you very much, doctor.
You're welcome.
Okay, Doctor, I have the last question here with me. Wherein one person has spoken about MS Hub. So she just said that, all of a sudden I have MS Hub. What can I do about it?